Hi, Dr. Phil Gendreau here. I'm here to talk to you about taking impressions. I just wanted to start off by saying I've been practicing for 13 years, and this is a technique that works well for me, but there's many other techniques and you just need to find what works well in your hands. So for the first step, you'll want to do your rough preparation. So what this involves is you want to remove 1.5 to 2 millimeters from the occlusal, from the biting surface right here, and then remove about 1 millimeter all the way around the tooth. Now it's important that you have at least 1 millimeter of separation between the adjacent tooth, so right here and right here. Then for the next step, I assess the tissue. If there is bleeding, I use VISCOSTAT. VISCOSTAT, it helps to coagulate the tissues and stop bleeding, and it works well if you put a little bit of pressure. And once you have all the bleeding stopped, or there's just a little bit of bleeding, you're ready to go to the next step. For the next step, you want to choose which cord you want to place inside the tooth. So for most teeth, I'll use a 00 cord and then a 0 cord. If the tooth is periodontically evolved, then I'll use a 00 cord and a number 1 cord. And then if it's an anterior tooth where the tissue is really thin, I'll use 2 00 cords. And the size of the cord just corresponds to the cord's thickness. So now I'll take the 2 cords and I'll soak them in VISCOSTAT. And then I will dry them by patting them lightly with gauze. Then take your cotton pliers and grab the cord so that it makes a U shape, and grab the cotton pliers and then put it on top of the tooth. That way the cord will go 3/4 of the way around your tooth. Gently pack in the cord interproximally first. The tissue is tighter here, so it's easier for it to go inside the tissues. When packing in the cord, it's important to do what's called backpacking. So when you gently place the cord inside, you want to push it a little bit slightly towards where you were starting. Otherwise, if you keep pushing down, it can pull the cord out. And then if you don't push in the cord enough, it'll have a tendency of coming out. And if you put it in too tight, you'll actually hear your periodontal ligaments tear. So it's important to learn the right amount of pressure. And the more you do this, the more comfortable you'll get and the better that you'll get at placing the cord in. After the cord has gone completely around the tooth, verify that you don't have any bleeding. If there's a little bit of bleeding at this point, I would put some more VISCOSTAT and make the tissues really dry and make sure that there's no more bleeding. Then for the second cord, you will repeat these steps, but I don't go around on the buccal because I'm concerned about any recession. So I have the second cord go interproximally and on the lingual. It's a great idea to leave the cord in for at least 5 minutes. So during this time, I make good use of the time by doing the buildup. So after I've placed the buildup, I'll finalize the preparation, smooth out the buildup, and then I'm ready for the next segment, which gets us ready for the final impression. So the next thing I do is I take the quadrant impression, the triple tray, and I try it inside the patient's mouth, and I tell them to close down gently. So for this step, I'm verifying the patient's bite, make sure I have the proper occlusion, and then I'm also making sure that the triple tray is not interfering with them closing down. And if everything is looking good, then I'll tell my assistant to go ahead and start loading the triple tray. I will remove the top cord and make sure that there isn't any bleeding, and I'll make sure that I can see the impression very clearly, that there's no tissues over the margin, and I can see directly every single part of the margin. And then I will take the light body and I will point the tip of it directly into the tissue. On the picture here, I'll point the the tip of it directly into the tissue, and then very slowly I will bring the tip all the way around, that I first cover the margin first, and when I expel the light body, I will remove it very slowly. I have found that if I expel the light body very quickly, I get a lot more air bubbles. So this is a step that I just take my time to get the best result. After I've gone all the way around, I will cover the rest of the preparation as well. And then I'll take the impression from my assistant, put it inside the patient's mouth, and have them close gently for 3 to 5 minutes, depending on the impression material. And after the patient's closed down, I will also verify on the patient's other half to make sure that they're in the proper occlusion. Okay, after the time has passed, I will have the patient gently open up. I will remove the impression material. Now, the first thing you want to do is you want to look at the impression. So that just sends a message that you don't really care too much about the patient. So I look at the patient in the eye and I say, are you okay? Because nobody likes to have impressions taken, so they want to make sure that they're okay. And then I will look with my loupes or magnifications, and then with the light, I'll look very closely at the impression, make sure I've captured everything. And the goal is to capture some of the root and capture actually beyond your preparation. That way the laboratory will have more information to give the proper contours of your crown. And if there's any doubt that I didn't capture anything or something just doesn't look 100% right, I will retake it, because these patients are paying a lot of money and a lot of time to be in the chair, and you want to do your best to take really good care of them. I hope this time was beneficial and you learned a thing or two about my techniques, and that it can be helpful for you. And I just wanted to say a quick little thing about 38 Smiles. This has been just an incredible lab for me to work with. They do fantastic work. They can get cases turned around really quickly, and I've been doing very little adjustments, and they've been just so willing to work with me and get cases done great. So this is an amazing lab. Thank you, 38 Smiles. Thank you for watching. Bye.